it's never too late. There's always that chance. Like I like to say, God might give you a second chance. So if you listen to this and you say, yeah, you know what, I've been thinking about it for a long time to see whether if I stop smoking today, I'll have a chance to prevent a heart attack or a stroke from happening, I'll say stop it. And maybe your lungs, your blood vessels might still be able to remodel and prevent you from having a stroke in the future.
Hello, and welcome to another episode of Your Health Matters by Sorogi. I am your host, Vivian Nacho Ayok, and with me today is Dr. Fonkem, and we're going to be talking about stroke. Dr. Fonkem, welcome to the show.
Thank you so much, Dr. Ayuk. It's good again to be back for another episode hosted by Sorogi.
Awesome. You and I have been friends for what, over 20 years now? I believe we met in boarding school back in Cameroon, right, for high school, and have stayed friends ever since. You were very popular in high school, I must say, and I think a lot of us were really confident. I mean, we knew you were going to do amazing things professionally, but I don't think a lot of us ever dreamt of seeing you someday as a neuro-oncologist at Baylor Scott and White. So super proud of everything you've done. But really, break it down. Share your story with our audience, who you are and what you do.
Man, those were some very kind words from you. But as you said, I've been very lucky and blessed in my own life because about 25 years ago, when we left Cameroon for the United States, what I call the American adventure, never in my wildest dream did I believe that we'll be sitting here together to have this kind of conversation. Because seeing where we came from, what I call very humble beginnings, to where my own career has ended up right now, I don't just know how to start to imagine. But when I left Cameroon after my advanced levels, we relocated to Chicago. From Chicago, we moved to Wisconsin, where I was lucky to attend UW colleges, where I had my associate degree in science. Then from there, I moved to UW Madison in Madison, Wisconsin, where I graduated in 2002 with a Bachelor of Science degree in biochemistry. I was lucky to attend the Ohio University Heritage College of Osteopathic Medicine, where I earned my Doctor of Osteopathic Medicine degree in 2007. And then from there, I moved to the Ohio State Medical Center in Columbus, as the name is often called, where I trained for 4 years as a general neurologist. So I would say that I'm boarded by the American Academy of Neurology as a neurologist. But after 4 years at Ohio State, then I transitioned to Harvard Medical School, Beth Israel Deaconess Medical Center in Boston, where I did a 2 year fellowship in neuro-oncology. Then from there, I started my first assignment about 11 years ago as assistant chair of neuro-oncology at Baylor Scott and White. And during my first 7 years at Baylor Scott and White, I served as an attending neurologist and also a neuro-oncologist. Then I was there for about that 7 years until an opportunity came for me to take much bigger responsibilities as the William Shapiro Endowed Chair in Neuro-Oncology at the Barrow Neurologic Institute in Phoenix. and also as an associate professor of neurology at the University of Arizona College of Medicine. I was there for almost 3 years until lately I returned to Baylor Scott and White again in the same capacity, but at this time leading a system-wide effort in brain cancer and also growing the neurosciences. I'm currently a professor of medicine at Texas A&M College of Medicine and also a professor of medicine and neurology at the Baylor College of Medicine here in Texas.
Awesome. That's a really impressive career you've had. And we're super, super proud to have you here with us today to really talk about stroke. So, heart attacks and stroke are really two of the leading causes of death worldwide. So, to help our audience truly understand stroke, we're not going to talk about heart attack today. So, let's start off with what's a basic definition of a stroke?
So when we talk about strokes, we'll talk about there are two types of strokes. We'll have an ischemic stroke and a hemorrhagic stroke. An ischemic stroke is a stroke that is formed when a blood clot travels from some part of the body, but the most common places are your heart, all the way to the brain where they can form a clot, and that clot can prevent the flow of oxygen to the areas of the brain or surrounding regions that require oxygen at all times. And when that happens and there's impeding of oxygen to supply nutrients into the brain, that can form an ischemic stroke. And that is about 85% of all the strokes that happen in the brain. On the other hand, you could also have what we call an hemorrhagic stroke, which is a stroke that is formed when there's a lot of pressure built inside the blood vessels to the point where the blood vessels can stretch and rupture. And that happens in 15% of the cases. And that is probably due to patients who have a lot of what I call uncontrolled hypertension, or they have abnormalities in their blood vessels.
And just so we can clarify for our audience, a heart attack is definitely not a stroke, right?
Sure, a heart attack, as it's called it, happens in the heart. A stroke is what I call a brain attack, but the mechanism of formation are all the same. Because when you have abnormal blood vessels happening in the body, they might happen in the heart or they might happen in the brain. If you have clotting processes happening in the body, they do not discriminate. You have the same kind of processes happening in the heart as you also have them happening in the brain.
Awesome. Thanks for that, because I heard people throw those words and think it's the same thing. So it's always great to clarify. So let's talk about what are some of the signs and symptoms that people can recognize or at least notice when someone is having a stroke.
For stroke, as I like to call it, the big things will be either weakness in the one limb compared to the other, facial droop, uh, which is when your face becomes asymmetrical, or you might have some changes in sensation, the way your body senses things, or you can have some weaknesses on one part of your body when compared to the other. Those are some of the most common signs. But most of these typically happen because uh, most of the functions in the body are controlled by the brain. So if a stroke is occurring in a certain part of the brain that controls a certain function and that function is affected, then you're going to have those kind of signs.
And what about speech difficulty? Do people sometimes have a hard time making sense
Yeah,
and just talking?
yeah, some people can have language problems or they can have what we call pronunciation problems, what we call dysarthria. So if you have a pronunciation problem where you cannot pronounce things rightly, then that is by itself is called dysarthria. And that is because you have a stroke that is occurring in the part of the brain known as the brain stem. As compared to if somebody cannot name an object or they have difficulties with understanding of language, then that is called an aphasia. And you could have like what is called a Broca aphasia or a Wernicke's aphasia. So a Broca aphasia is somebody who has a disorder of language around what we call the left frontal area of the brain for the most part, where they can understand language where, but they might not be able to verbalize what they're understanding. On the other hand, somebody can have what is called a Wernicke's aphasia, where they don't have a problem speaking, they just have a problem understanding.
Good, good to know that. And what about timing? As soon as the symptoms or signs are recognized, would you say time is of the essence then in getting help?
Whether it's a heart attack or it's a stroke, time is money. Usually, if you're really going to help anybody having a stroke, you want to make sure that you can recognize the symptoms early on and try to call 911 or get them to the closest emergency room. Because if you're having a stroke, especially an ischemic stroke, then the first 3 hours are very important if you're thinking of having that patient to the nearest emergency room where they can do a quick exam, get a CAT scan, and see where there's no blood in the brain, and start to give those patients what I call clot busting medications to dissolve the clot. So if somebody has gone past that window of opportunity at that point and they are not a candidate for what they call mechanical retrieval of the clot, then most of what you do at that point is what we call a secondary prevention, where whatever you do, which might include getting an MRI scan, checking for clotting or stenosis of their blood vessels, or checking to find out where they have like an atrial fibrillation, checking to find out where they have diabetes or high blood pressure, that will be considered quote unquote secondary prevention. So if you really want to reverse the symptoms of a stroke, timing is much, much important because you want to recognize the symptoms early and try to see if you can do something to reverse them.
Really good information. And what about quality of life? You talked about, really important in the first 3 hours because that's an opportunity to have those life-saving medications. And past 3 hours is just management. But what about quality of life after that 3 hours?
Actually, if you can do what we call the initial intervention during a stroke and you are able to reverse those symptoms, then that patient might go on to have a better quality of life because they might not have any neurological deficits. It is only when we fail to reverse those symptoms early on and and the patients are left with maybe language problem or a speech problem or weakness problem or a problem with walking that their quality of life might take a little bit of a decline. In that, if they were used to walking and the stroke affected the areas of the brain that are involved in movement, then they could go from being able to ambulate independently to being wheelchair bound or maybe using a walker for ambulation. So in that regard, the quality of life might be affected. Or if they were used to speaking and the stroke involved an area of the brain that is involved in language and they lost that ability because we are not able to reverse those symptoms within that window of opportunity, then that could have a big effect on their overall quality of life.
What about risk factors? We've talked about what it is, the importance of getting care or seeking care in a really timely manner. But what are some of the risk factors then for stroke?
One of the biggest risk factors of strokes, as I like to call them, age is a big risk factor. Anybody 50 years and older is always going to be at a risk of having a stroke. But when I look at risk factors, I like to call them modifiable and non-modifiable risk factors, right? You
Correct.
cannot change your age. If you're 50 years old, you're 100 years old, you cannot modify that risk. Even though age is a risk factor, it's just something that we'll have to know. They'll also have what I call the modifiable risk factors, and those will be something like high blood pressure. If you do have high blood pressure, please seek help and make sure you're reducing or you're treating the high blood pressure. Another risk factor will be a history of diabetes. If you have diabetes, also make sure you're seeking help with your primary care doctor, your diabetologist, and making sure we're getting that diabetes under control. If you do smoke, make sure that at least you stop smoking. Then the other risk factors will be exercise. If you can exercise well, which we typically will recommend that people exercise at least 150 minutes every week minimum. Make sure you do that. And diet. Those who have a good diet, which is low on fat, low on salt, and high on fiber and antioxidants, probably will do better in terms of a stroke prevention.
All righty. You talked about modifiable versus non-modifiable risk factors. Okay, let's stay with the non-modifiable risk factors. You talked about age. We're all blessed if we could get to 50 and above. That's a blessing. You can't do anything about that. Every one of us wants to get older, or at least live long, and enjoy life to the fullest. But what about genetics? Does genetics play a factor in your risk for stroke?
Of course, it does. Every disease has a genetic component and also an environmental component, right? Genetics plays a big factor, especially in the African American population and also in patients of Middle Eastern descent. And one example of that would be sickle cell disease. Sickle cell is also a risk factor for stroke. Why? Because we all suffer, those who have sickle cell tend to have the ability to form a lot of clot. And I said clotting was a risk factor for ischemic stroke. And secondly, those who have sickle cell because the red blood cells form a sickle shape, and that actually impedes the flow of oxygen and makes the brain not use oxygen well. So that could also be a risk factor too. But there are also some other genetic diseases, especially for those of Northern European ancestry. And a good example of that would be something like factor V Leiden disease, which is seen a lot in folks of a Northern European ancestry, where if you have factor V Leiden mutations, that might also make you more prone to developing clot. Or if you have like what we call factor S deficiency or anti-proton beam mutations, that can also make you more prone to forming clot and maybe be a risk factors for developing ischemic stroke. Yes.
All great information. I have to ask, that was really a lot to take in. So I'm sure our listeners who are probably going, it's hard enough finding a partner, Doc. Are you telling me now, should we be checking family history now and all of that? So, on a scale of the modifiable and the non-modifiable risk factors, which is playing a much more bigger role?
I think the modifiable risk factors are probably, in terms of incident, played a much greater role than the non-modifiable risk factor, at least I mean, the way I've seen it. Because with the aging population, with stroke being the fifth leading cause of death in the industrialized world, we see that that is probably because of one, high blood pressure, which is very predominant in our society, two, diabetes, three, high cholesterol, and also four, smoking, right?
Perfect.
And
Yep.
these are all what I call diseases of the age, and also diseases that are due to dieting or lifestyle. So
Lifestyle.
I truly believe that if we could modify those If we could modify our lifestyle, we'll be able to really cut down on the incidences of those diseases and therefore live a lot healthier lives and also reduce our own risk of stroke and other cardiovascular diseases or what I call metabolic diseases, which seems to present as we all get older.
Good point there. I'm so happy you brought up smoking because I think when we're talking about lifestyle, people will be thinking, exercise and diet and not really thinking about stopping smoking. So good point there that you bring. The next thing I want us to address when we're talking about stroke is strokes preventable?
I believe that strokes are preventable. One way to do that is if you have high blood pressure, treat it aggressively. If you have diabetes, treat it aggressively. If you do smoke, stop smoking. If you have atrial fibrillation, which is also a risk factor for stroke, make sure you see your cardiologist and get yourself medication. If you don't have a good lifestyle, which I mean by what do I mean by that? If you don't eat well, make sure you get yourself on a good diet, low on fat, salt, and high on vegetable antioxidants, and also low on carbohydrates. If you do not exercise, make sure you get yourself on a good exercise regimen. I truly believe that if you could do all this, you might be able to reduce your risk or even prevent your stroke or prevent a stroke from happening.
Awesome. All right, this part here, we're going to talk about some of the misconceptions about stroke. Okay. So, the first one I want you to address is strokes only happen to elderly folks. Is that true or false?
That is false. Strokes can happen to everybody. It doesn't discriminate based on age.
So, this is something that everyone should be paying attention to. Based on your experience, are you seeing more younger people showing up with stroke?
I'm seeing a lot of younger patients in my clinic right now with strokes than I did about 14 years ago. But I think that part of the reason is because of what I call our lifestyle. I think most younger people are not practicing the healthy lifestyle that their parents did. We have a lot of obesity is a big epidemic right now in our own society, and with obesity comes high blood pressure, comes diabetes, which to a certain extent might be a contributor to some of the increase in the incidence of stroke we see right now. Then the other issue is drugs. We have a lot of the recreational drug use in our own communities, especially a drug like cocaine, which also increases the incidence of both ischemic and hemorrhagic stroke, which could be one of the reasons why we see more young people coming down with strokes than we did before.
Good point there. Thank you. What about this one here? That there really is no treatment for stroke. Is that true or false?
That is not a fair or true statement. If you remember during my earlier introduction, I said stroke could be treated. And when I divide the treatments of strokes, I like to divide them into acute and chronic. In terms of the acute management of stroke, the most important thing is time. If you're having a stroke and you see within a 3 hour or 3.5 hours window, and you are able to get to the nearest emergency room that has a comprehensive stroke program, they might be able to use clot busting medications to reverse those symptoms. Even if you've gone past the 3.5 hours window and they still have a very good brain attack program in that hospital, they could still use some other alternative means, such as what we call a thrombectomy or using what we call mechanical retrievers to go in and retrieve that clot. So, in a way, that can be a good way to reverse the early symptoms of stroke. But once that window has passed, then at that point, what we'll do is what we call secondary stroke prevention. where they start to look back to say, well, was this stroke caused by atrial fibrillation? And if we can put you on an anticoagulant to prevent your blood from clotting, can that prevent another stroke in the future? That is often done. Or if the stroke was caused by high blood pressure and you are put on antihypertensive medications to control your blood pressure, that is called secondary prevention. Or if that stroke was caused by diabetes and they put you on very good anti-diabetic medications to prevent or control your diabetes, then again, that is called secondary prevention. So from this kind of a holistic approach, I believe that we can reverse some of the stroke symptoms and we can also try some other ways to prevent some other strokes from happening in the future.
What about gender differences? Let's start with signs and symptoms. Are there any differences between men and women in how they present?
To the best of my knowledge, I really don't think there are a lot of gender differences in presentation of stroke. However, I know that most women tend to go to the hospital more than men. So I'm sure that most women might be able to have their stroke reversed a lot better than men because they will tend to they will tend to present within a reasonable window to make a difference as compared to us men where we wait until things are really bad before we show up to the hospital.
I think some women would disagree, say that they're caring for everybody else and sometimes ignore those symptoms too. The modern woman now is doing three or four different things. And I think there is a possibility you caring for the kids, you know, making sure everyone else in the house is okay. It's really easy sometimes for women to forget. So I think women too can fall in that category of delaying seeking care because we're so focused on making sure everybody else is okay and thinking of ourselves last.
That I can see that as a possibility, but if we really look at the trend, for the most part, I think women might fare a little bit better than men just because we don't want our families feeling sorry for us just the way we've been built to make sure that we're in control.
I think you touched on this a little bit earlier, and but I want to make sure that everyone really understands when we're talking about seeking care in a very timely manner. So, if a stroke symptom goes away, you don't need to seek medical attention. Would that be correct or wrong?
I'll disagree with that because if you have what we call, what you're referring to is what I call a TIA, which is what is called a transient ischemic attack, where somebody can have some stroke-like symptoms that resolve within 24 hours.
Hmm.
For example, somebody wakes up and they have a facial droop, or they have some slur speech, or they
Hmm.
have weakness that is gone within 24 hours. And then they just fold their arms and say, you know what, I'm cured. But from my own experience and from what we know, if you start to have those TIA symptoms, what that means is that if you don't go back and fix the risk factors, which might be modifiable, then the chances of going on to have a full blown stroke might be very high. So I will urge the audience to go to the hospital if they are lucky to have those symptoms that reverses within 24 hours, to go back and have a TIA workup to find out why they're having those symptoms in the first place and to see where something can be done to reverse them or to correct them so that they don't go on to develop a full-blown stroke.
What you're saying is bottom line, if you're experiencing symptoms, you still should seek care, even if the symptoms go away.
Correct.
So help us again with this one. Okay. We talked about lifestyle earlier on, but let's go into a little bit more detail. What if someone says, I've been smoking for 20 years? What's the point of, I haven't had an issue yet. What's the point of stopping now? Would you say there is still benefit to stopping cigarette smoke, regardless of how long you've been smoking?
I agree that even if you smoke for 100 years and you can stop smoking, I think there might be some time for your blood vessels to remodel. Encourage most of my audience watching this to say, yeah, it's never too late. There's always that chance. Like I like to say, God might give you a second chance. So if you listen to this and you say, yeah, you know what, I've been thinking about it for a long time to see whether if I stop smoking today, I'll have a chance to prevent a heart attack or a stroke from happening, I'll say stop it. And maybe your lungs, your blood vessels might still be able to remodel and prevent you from having a stroke in the future.
Awesome. So, regardless of how long you've been smoking, stopping is always good. Never too late, correct?
I agree. It's never too late.
Hypertension, in terms of lifestyle and really having good control of blood pressure. Talk a little bit more. We mentioned that earlier on in passing, but how big a factor does uncontrolled hypertension have on someone developing stroke?
Hypertension might be one of the leading causes of stroke and heart attacks. And that could probably explain why, as we get older, we have a large percentage of our own US population having strokes. And that is because after a certain age, I would say by age 30, some of us are already pre-hypertensive. And when I say pre-hypertensive, I'm looking at a blood pressure of between 130 systolic over 80 diastolic. And as you start to go on a year by year basis, then we'll start to see that rise in those two numbers. And by the time you get to be in your 40s, if you're not careful, those numbers could start to go up to about 140, 150 systolic, about 90 diastolic. And that start to put a lot of pressure on those blood vessels. But I believe that if we use aggressive treatment, which might be either using antihypertensive medications to lower that blood pressure down by even 1 to 5 points diastolic and systolic, that might be that big game changer in reducing that pressure that is put on those blood vessels and prevent us from having a stroke. And that can also be done through medication, as I said, or by just dieting and maybe changing what you eat, or maybe exercising more because we know that exercise is very good for the body. Because what exercise does is that every time you go out and you take a walk or you go out and you run, that helps to dilate your blood vessels and that helps to decrease your blood pressure. So I will not really emphasize on the importance of what an uncontrolled high blood pressure can do to our body, but research has shown that if you can reduce your blood pressure by just 5 systolic points or diastolic points, that might have a lot of implications on preventing the heart attack or brain attack.
What about stress?
Stress is equally the same. Stress is never good to anybody. If you are stressed out, your blood vessels constrict and they can increase your high blood pressure and also cause a stroke or a heart attack. And when you reduce your stress by one, exercising, two, making sure that you can live a well balanced life, that also has a lot of implications in reducing your stroke risk, your heart attack risk, and even your cancer risk.
Very good point there. I hope our audience will pay attention. I know we are all here trying to live the American dream. And unfortunately, sometimes stress, is part of that process. So not having really good and healthy ways of managing stress can affect our overall health. So it's good to know that we're not just talking about other chronic conditions, but stroke as well. That stress is a big factor to think about. So we talked about diabetes and having uncontrolled blood sugar levels as being a major risk factor as well for stroke. So Talk to us. Like when we say uncontrolled diabetes, people are thinking sugar. What has sugar got to do with stroke?
Where uncontrolled diabetes can cause what we call a metabolic cascade. And that metabolic cascade can affect blood vessels. In that, if you don't control diabetes, then the blood vessels, because of that cascade, start to harden the blood vessels and they make it difficult for those blood vessels to relax and contract when they have to. And that on its own can put a lot can make it easy to develop clot. And that is a clot that can impede oxygen transportation in the brain and also in the heart and can cause a brain attack or even a heart attack. So ideally, we would like our blood sugars to be less than 100 if you're in a fasting state. And also, there's another number we like to call the hemoglobin A1C. And the hemoglobin A1C is a term that is used when glucose is deposited by certain proteins that the body make on the surface of blood vessels. And if that number goes above 6.5, by indication, that means that we're not doing a very good job of controlling our blood sugars in the body. So for those who have the number above 6.5, that might have a lot of implications in that will put us at an increased risk of having brain attacks or what I call strokes, and also at an increased risk of developing heart attacks. And that might also not only hang around those two conditions, but that might also make it more easy for us to develop what we call kidney disease, which is another culprit that I did not talk about today, but also very important. And also develop nerve damage, what we call neuropathy, and also eye disease known as retinopathy, which are all complications of uncontrolled diabetes.
All great information. So, thank you for helping us clarify some of those misconceptions about stroke. Now, let's look at life post stroke. What is it like when people say discharge, the emergency phase is over, they get to go home? What can people expect when they get home? Like, what are some of the changes that could happen, and what does that long term care look like at that point?
Yes, the care of patient post-stroke depends on so many different factors. One, if somebody has a stroke and they are lucky to not have any neurological deficit, they might be able to just go home on what I call medications that can help them to modify their risk. And some of those medications might be a drug like a baby aspirin. We just have to thin your blood so that you don't develop another clot. Will be something that will be sent home for a patient to take on a daily basis to prevent another stroke from happening in the future. But if somebody, in addition to a baby aspirin, also has evidence of high cholesterol, then we might put them on a medication known as a statin or like Lipitor or atorvastatin, and that will help them to prevent what we call plaque to be formed around their blood vessels, and that could also help them to prevent an eye stroke in the future. And the third option might be blood pressure medication for those who had a stroke and the risk factor was because of high blood pressure. Or if somebody had a stroke that was due to an irregular heartbeat or heart rate, they could go home with a medication such as Coumadin or Xarelto, which are just medications to thin the blood a little bit so that they do not form clot. That is how you medically manage these patients. But on the other hand, in addition to the medical management, some patients might also have some deficit. And what do I mean by deficit? An example of that might be speech, where a stroke resulted in the patient inability to understand language. So they might go home with a speech therapy, or they might go to a rehabilitation center where they work with the speech therapists to help to improve that function. Or if the stroke resulted in weakness, they might either be sent home with physical therapy or they might be sent to a rehabilitation center where they work with all these physical therapists to help improve that weakness. And that is the same too with somebody who also has maybe visual impairment, where in addition to speech, they might also have occupational therapy working with them to make sure they help them to better uh, work with some of the deficits that they might have suffered as a result of that stroke.
You did mention baby aspirin. I want to make sure our audience understand. We don't want everyone running out now and getting a baby aspirin, right?
Of course, I always like to tell my patients that everything we do to you in the hospital has some potential benefits, but there are also risks associated. And in the case of a baby aspirin, I know aspirin is very cheap. With $2 to $3 in your pocket, you might be able to get yourself a bottle of aspirin from CVS or Walmart or any other pharmacy. And that can actually help to prevent a stroke from happening. However, one of the risk factors or one of the side effects of aspirin is that aspirin can also cause internal bleeding. So it is important for those who do not have the risk factors of stroke and are thinking about going on a baby aspirin to make sure that they consult your primary care doctor to make sure it is actually safe for them before going on to take a baby aspirin.
Very good point there. So we don't want anyone just going out there and just buying the biggest bottle of aspirin from Costco. Definitely talk to your healthcare provider, make sure it is appropriate. So really, really good point there. So we're coming to the end of our show, Dr. Fonkem. What is one or two final things you want to leave our audience with? If someone doesn't remember anything, what is the one or two final message you want our listeners to take to heart?
I think the most important thing is that strokes are preventable. And if we can modify our risk factors, we will be able to prevent stroke. And what do I mean by modifiable risk factors? For instance, if you have a history of high blood pressure and you are listening to this, make sure you take aggressive steps by seeing your primary care doctor to make sure that blood pressure is treated. If you have diabetes, do the same thing. Make sure you take aggressive steps to make sure that we can better control that diabetes. If you have high cholesterol, take aggressive steps to make sure you can do that. Also, make sure that you exercise regularly and also make sure that we try to eat a good and balanced diet that is high on proteins and vegetables and low on carbohydrates, fat, and salt. And the other take home message is that for those who do all this and they are still unfortunate to develop symptoms of a stroke, know that time is money. Time can save life. Make sure that if you ever come across with those kind of symptoms, make sure you call 911 or ask a family member to call 911 to get you the help that you might need that might be able to save your life and reverse those symptoms.
Well, you heard it from the good doctor. Thank you so much, Dr. Funkem. It's really been a pleasure having you on the show. And I know you'll be back again to talk about some of the other things we have planned, like cancer and some other topics. So, truly appreciate the information you shared today. And I'm sure our listeners were taking notes as we're talking. And I cannot say how grateful I am. I know we've had been trying to get this together. It took a little while to put it together, but super grateful we're finally able to make it work. So thank you so much for joining the show today. I truly appreciate it.
I want to thank you so much for having me tonight. I think you're doing a wonderful job in educating the community on how to live healthy and balanced lives so that they can have a better quality of life. And please continue with that good work.
Truly appreciate. Thank you so much. And to our listeners, if you've enjoyed this show, please share with friends and family. You know we love hearing from you. So any feedback is highly appreciated. Any comments about future topics and who we should have as a guest would something that we really take seriously here at Sorogi. So thank you all for listening. And until next time, remember your health matters.